and to see all of the progress that the state has made and that the priority the state has put on addressing medical debt and the ways in which it has, and also, we kind of, Citizen Action and our New Jersey Healthcare Coalition partners kind of look at addressing medical debt in a comprehensive sort of in-depth, and that, it will require alleviating current debt, making healthcare more affordable, increasing the protections for our patients and healthcare consumers, and then doing some systemic changes like we've heard about some of the speakers before. And so appreciate what you have laid out in some of that progress. And I know that we have some, if I can plug if I can plug our resources in the back, some information about the Louisa Carmen Medical Debt Act, and also some of the resources to come. But I did want to talk about, what do you see as far as what do you see is next for addressing medical debt? What would you like to see happen next in the state?
It's a very good question. I think it's fortunate you put up the end debt website up here, just as you brought that up, because the Louisa Carmen Act just fully went into effect in July of 2025. It was passed in July of 2024. There was 365 days before certain parts were effective. But the protections really kicked in then. And while there are parts of the Louisa Carmen Act that require creditors to provide information to people with medical debt about what their rights are, about the protections of the Louisa Carmen Act, I think that the most important thing right now is making sure people know about it. And so I see that as a big part of the value of the work with under medical debt as well. You sent out 770,000 letters to folks. And of course, eliminating that debt, I think, has a big impact on those individuals. But it kind of raises the salience of medical debt much more broadly, and kind of makes people aware of it as an issue, which will then prompt them to think about medical debt more broadly in the way that MJ does. And so if you don't know about Louisa Carmen Act, about the protections that you have for your medical debt, and in a lot of situations, if you don't know the options that you have for getting healthcare paid for, when you're in the hospital, when you're coming out of the hospital, which I think is covered in your report website. It's great. But getting information out there so folks know about it, and this is, I think you've seen this all day, but this is such a huge deal in any consumer protection field, is that the consumers have to know that they're protected, they have to know what the protections are, they have to know how to kind of vindicate when their rights have been infringed upon. And so to me, like, getting the information out there about Louisa Carmen Act so we can see it have more of an impact. That's what I think is, like, that communication piece, making people aware of things right now.
Yeah, and some of the particulars about what kicked in over this summer. Initially, there was a ban on reporting medical debt, most medical debt to credit reporting agencies. And if someone were to see that an amount had been reported, that amount is to be automatically void. And that was right away. And then starting this summer, expectations, which I think that's a robust, some robust protections I think that the state has brought for our residents. Something that the coalition has been looking into is the idea of creating a court diversion program for medical debt and looking to pattern it after the foreclosure mediation assistance program, and that it would be a statewide program that would include counselors that could help counsel people to resolve their debt with mediators before it even gets to court and starts going. And so something that we've been working with the courts, and also hopefully we can see some forward movement on that in the next session. But I did want to also ask you if there was anything else, any other solutions that have come out of some of the state's review and reports. I know there were even the Department of Banking and Insurance in response to the HARP report, or at the same time the HARP report kind of came out last year, offered some solutions. And if you're able to talk about any of those, that would be great.
Sure, yeah. So as part of our reporting from OCAD, there were a number of reports that we put out in October of last year. December last year was October. And some of them looked at the kind of healthcare cost growth benchmarking numbers that I described earlier, and some of the drivers of healthcare cost growth. But one that was prepared by the Department of Banking and Insurance had some recommendations for how to address growing healthcare costs, right? Because if healthcare is more affordable, it won't create medical debt in the first place. And so they had a variety of insurance regulation things, which I thought were very, very interesting and very much the business of the Department of Banking and Insurance and their experts. But they did. They had a whole variety of requests in there. One was kind of going beyond the insurance regulation. They had mentioned the creation of an all-payer claims database, which I think relates, and also I think that would be very helpful in this space. It's hard to know about that. We understand that it impacts many people, and if you kind of aggregated balance sheets from creditors and hospitals and health insurance companies, you could figure out how many people are impacted by this. There are a lot of organizations who want to survey data to try to figure out what's in collections. You can look at data from credit reporting agencies like Experian and TransUnion, and that has some challenges. But it's hard to know kind of where the debt is and how much of it there is. Because if you start looking at the sources like Experian and TransUnion, they elected to stop reporting medical debt a few years ago. And they can do that if they want. I think it's very important that, for example, the Police Department Act now has, New Jersey, through the Police Department Act now has a statutory requirement that they may not do that, because they can change their minds in the future, New Jersey. And so the data you get from them doesn't have a lot of debt that otherwise would have been reported to the credit rating agency. And so you're relying on survey data and trying to figure it out. And when you're developing policies, you have to know where the problem is and how extensive the problem is. I'm sure there's a lot more medical debt than you see when you look for it. And so, you know, you have numbers, huge numbers of New Jerseyans, forego medical care because of medical debt, and that makes everyone unhealthy. They avoid spending on other things because they have to pay off medical debt. And medical debt's different than other debt. I mean, no debt is good. I'm not going to be the defender of consumer debt anywhere but just this conference, but medical debt is so often the result of something completely beyond the control of the individual. That if you look at the presence of medical debt isn't even associated with other debt and the likelihood of failing to pay off other debt. It's just completely independent of everything. And so it has no value in terms of predicting someone's future actions, in terms of whether or not they'll be able to pay off. And so that's why, allegedly that's why the credit rating agencies stop reporting it. But you still have to know where that is. And so any effort to be able to kind of understand where that is, and what populations to focus on, and then how best to tailor our policy solutions to meet the needs of those people is important. And so, we rely on these data sources that are out there that exist, but they're large and public, and in that couple of years. So it's going to take a while before we can measure the impact of something like the Police Department Act or other efforts. During that time, I think getting the word out and educating people about their rights and their protections is the most important thing to do. But any possibilities to kind of learn more and understand more about medical debt, I think will just help everyone. We'll just be able to inform us to develop better policies.
We certainly, of course, establishing a state healthcare claims database is definitely high on our priority list. Real rate review in the state, enhanced rate review, and enhancing that, one of our priorities as well. Strengthening and making permanent the efforts around strengthening and making permanent your office, of course. We want to stick around. But I also would like to hear from you, and I'm sure our audience would, if there's anything else that your office is working on that you just like us to know about. I would love to hear about it.
Sure. So, as I mentioned, we put out these reports periodically looking at the rate of healthcare cost growth at these various levels, provider, insurance, etc. And then we also put out reports attempting to understand the drivers of healthcare cost growth. And so those, we're examining pharmaceutical costs. Which of the high cost drugs, how are they being used? We looked at out-migration. Are people getting care in New York City? Is it costing more? Getting care in Philadelphia, and it's costing more. But we're always eager to hear and understand where to look next in terms of our cost driver analysis, as we call it, the cost driver analysis. And to understand kind of where those things are coming from. And then there's another report that we put out, which will be coming out pretty soon, which is called the New Jersey Healthcare Landscape. And so it's just like a compilation of publicly available measures of healthcare quality, healthcare access, affordability, and some medical debt measures this year we've incorporated. And it shows New Jersey with respect to nearby states, with respect to the nation, and over time, and how it's changed. And again, it gets to that question of like measuring medical debt is very challenging because policy changes at the federal and state level inform how much you can actually see of what medical debt is out there. That'll be coming up pretty soon, and I think it highlights those areas where there can interventions to help address problems. And then it also highlights where New Jersey does really well. It does really well on a lot of the quality measures. We're very careful before it, but you know, we just have to make sure that we can. But that was an answer.
That's great. You know, thank you for all of that. It's also really great to hear about all the things coming out. It's good to hear how prescription drug affordability is on the priority list. Of course, we're big supporters of our Prescription Drug Affordability Council and all of its work in the drug affordability unit as well. We really learned so much from you today. Thank you. So, thank you so much. And before I move it back to Beth, I did want to take a few moments as I couldn't have had a better person to introduce the website that our New Jersey for Healthcare Coalition partners, New Jersey Advocacy, and you know, was a big part of the creation of this effort, and co-leads the medical debt work group of the council, and also created and wrote the downloadable manual that's on nmednj.org. And so, you know, we saw behind us just kind of a going through the various pages. All the pages reflect chapters in the manual, but it really helps folks to navigate, you know, trying to access care, any question I think that you would want to know about medical debt and billing and charity care and navigating the court process if you happen to get because of your medical debt, providing sample answers and letters and payment plans and negotiating with your providers. It just has so much information on it. So we hope that you will, all of you will remember it, bookmark it, and tell your friends, your family, your communities about it, because as you said, the best way forward is to make sure that people know what protections they have, and it is a really robust and comprehensive resource. So I just wanted to thank you again, Jim, for being here with us, and I want to hand it back to you.
I'm not Bev. Bev, we have a hand there. Did you have a quick question?
Yeah, what would you recommend as the best option to increase affordability of our medical system aside from the right to discuss?
Oh, yeah.
There's an easy question.
I think transparency can go a long way. You know, one of the things that we really focus on in our reporting is making sure everyone can see where the cost code is occurring. The federal government right now is moving forward with a lot of price transparency and cost transparency stuff in healthcare. And so there are data sets now you can go out and find like key amounts for all kinds of things. And they're enormous data sets and they're incredibly unwieldy, and I think very, very few people have actually been able to use them because they're so big. But increasing that transparency, I think, is valuable. I think we do that direction. And so folks can kind of understand where costs are. I know I had taken a comparative analysis in class in graduate school. The professor had studied in Europe and America and Japan. that public reporting of certain things work as well as penalizing. I think it may have been in the UK or maybe in France. Worked as well as attempting to penalize for that. So the extent to which there can be more transparency, I think that can inform like larger purchasers of healthcare. I don't. I had enough grad school to know that people don't price shop and see medical like individuals. Like it can't work for a million different reasons. But purchasers like the state health benefits plan, like large employers, insurance companies, the more transparency about those costs out there, I think can inform their decisions, and those decisions can then help address those costs. Affordability, I think, just comes down to increasing access. Affordability conceived of as how individuals can experience healthcare costs. So, keeping Medicaid rolls high helps with affordability. One of the things you see in the medical debt literature is that folks with there are a lot of people with insurance with medical debt, certainly because insurance varies so much. But folks with Medicaid have less of that because things get covered by Medicaid. So Medicaid is fantastic. Making sure people are insured, making sure insurance is affordable, whether it's through federal or state subsidies and exchanges, whether it's through the types of insurance regulation changes that Laura mentioned, or the Department of Making Insurance report. That kind of expands the number of people who can afford the care, and that's kind of what I see affordability. Maybe expansion of access and coverage in a way that it doesn't break the bank, right? Like, if you just offer everyone in the state A+ healthcare at $25,000 a year, it's not affordable, right? It doesn't actually make sense. So those are the areas where I think that's like my area too, right? Like, I mean, it's like these large systematic health economics kind of things. And I think the stuff like this and then I think the thing is fantastic, the resources there, particularly around individuals who are facing medical bills, individuals who are facing medical costs at that individual level. I think the knowledge that's in those reports is really, really helpful. So making sure everyone knows about that is really good. And I have no connection to it formally. I sincerely believe that.
Jim, we have one other question here from Chris Estevez, our board chair, and I certainly am going to let him ask